Our next presenter is Dr. Ky Pohler. Dr. Pohler is a native of Texas, which is quite large, as you know. He completed his BS degree in animal science at Texas A&M. He then completed his MS and PhD in reproductive physiology at the University of Missouri, which is where I first had contact with him through his major professor. He then, after finishing his PhD, was a professor at the University of Tennessee for a while and is now at Texas A&M University as a reproductive physiologist. He also concurrently serves on the staff of Sao Paulo State University in Brazil, and he has graduate students in the U.S. and Brazil, so he's a busy young man. So, Ky, we'll turn it over to you now, and it should be in your hands.
Well, thanks, Boyd, and thanks CRV for the invitation to share a little bit about some of the things that we're working on. And but as Boyd mentioned, I'm at Texas A&M University, and one of the things that we're really interested in, we've moved to I'm in the animal science department, but have moved to more of a mechanisms of areas of excellence. And so one of the two areas of excellence, one that I head up is the pregnancy and developmental programming group, and then the other one that I'm a big part of is cattle adapted to tropical and subtropical environments. One of the things that we're really interested in at A&M, and one of the main reasons this is because Texas makes up such a large area in regards to a subtropical and even a tropical-based environment. And since about 70% of the cattle distribution across the world are located in these environments, this is something that we're really doing a lot of work in, hence why I'm specifically doing a lot of work down in Brazil and some of the things that we're interested there. One of the big areas that we really focus on is trying to understand pregnancy loss both in the beef and dairy cow, and I'm going to use a lot of dairy slides today that I think are more relevant for this group, but if someone has interest, I can also show a lot of the same data in regards to beef animals as well. But essentially, one of the things that we're really interested in is when you go into a group of animals and you look at, fertilization rate, for example, in the lactating dairy cow or even in the beef cow, those fertilization rates don't reach 100%. So essentially, in the lactating dairy cow and the high-producing Holstein here in the U.S., we're seeing fertilization rates somewhere around 80%, which essentially means that about 80% of the time, you're able to recover some embryo-like structure on day 7 of gestation. Now, I caution people here that this might not necessarily mean that we have proper fertilization. It just means that the ability of the sperm to get to the egg and to undergo at least a first cleavage happens at least about 80% of the time. Yet, once we look at the P1 data and first preg check data, we see pregnancy rates at least at somewhere at 50% or lower in regards to what's actually happening on the farm. So you see about a 30% loss that's occurring between the time of fertilization and the time that a P1 is done. And essentially this is even more clearly illustrated when we look at embryo transfer data. And I'm going to call this early period early embryonic mortality. Obviously a lot going on in regards to the stage, the embryo changing stages, elongating and signaling to the maternal environment. As we move forward from a P1 to maybe into a P2 range in the high-producing dairy cow, we're seeing pregnancy loss somewhere around 12%. In our beef herds here in the U.S., we're somewhere in the 8 to 10% range. And then as you drive reproductive technology, get into sex semen, get into embryo transfer, things like that, we see these numbers increase. And then as we go from day 42 or day 60, a P2 sometime out to calving, in the herds that we're working with, we're seeing this to be a little bit lower. Now, if I overlay this data and look at what we're seeing in our South American dairy herds that we're working with Girolando or even Holstein genetics in a tropical, subtropical based environment, these numbers are going to even be just a little bit higher. So this late embryonic mortality, after you have a diagnosed pregnancy, we feel like is costing our producers a lot of money, especially because those cows will go on for a number of days, basically, where they are essentially showing up as pregnant, but they're not going to end up pregnant at a P2, and so you got to sort of restart the process all over again. And we think those animals are costing us, again, quite a bit of money, specifically when we talk about controlled breeding seasons like Chris was talking about in regards to the New Zealand system, or in systems where we're trying to minimize days open in our large conventional dairies here in the U.S. Now, the unfortunate thing is that we know very little about this time period of pregnancy from day 28 to day 42 when a lot of this loss is happening. And it's an area that we really focus on in trying to understand what's taking place there. A few years ago, we did a number of projects in Brazil, basically asking the question, how much pregnancy loss occurs in the 7 days leading up to let's say like a P1 or something. And so we did 2 projects. This is Holstein cows here undergoing a normal Time AI project where we had the number of cows pregnant by a blood-based marker, PAG, pregnancy-associated glycoproteins, had a CL on the same side of the ovulation, and had a high progesterone level at day 24 of gestation. Compared to when we diagnosed them on day 31 of gestation, what we found is that 20% of them underwent pregnancy loss during this time point, which was quite surprising to me at the time, and I still feel like is a little bit high, but it points to a fact there's a lot of loss happening after maternal recognition of pregnancy, which is occurring around day 17 of gestation as we get out to this P1 preg check. At the time, I thought, well, maybe it's the lactating cow that's causing the issues, and so we did the exact same projects in dairy heifers where we used embryo transfer as a model. And this work is it was also done in Brazil with Holstein and Gerlando heifers. And essentially what we found is that 11% of the time we were diagnosing heifers pregnant on day 24, but when we were coming back on day 31 of gestation, those animals weren't indeed pregnant. Now, I'm not saying that our day 24 model for pregnancy detection is ideal because there's some challenges that go along with that. But what I want to point out is that there's some real pregnancy loss taking place in this window even earlier that's probably falling into this situation of calling some cows pregnant at P1 as those pregnancies sort of drag on. So essentially the big question that we've been after and where our federal funding from USDA is really pointing us is asking the question as to why when you have a positive P1 pregnancy diagnosis, whether you diagnose them by blood, milk, or ultrasound, why do some of those animals go on to maintain their pregnancy and calve, and why do some of them end up undergoing pregnancy loss? And so what controls pregnancy loss? And I'll tell you, I'm really sort of on the fence about what controls it. There's 2 obvious players when you think about it. You have either the female contributions or the male contributions to this. And for a long time, we basically have made the assumption that the male plays a really large role in pregnancy loss early in gestation, around the time of fertilization, and maybe in these first early embryonic development stages. But as we get out, probably there's more contribution coming from the female as you sort of set up this uterine environment that's conducive for pregnancy, etc. And one of the things that I'm going to show you some data that we're really challenging this. We don't actually think that the male actually plays that large of a role as long as the semen's capable of getting to the site of fertilization and fertilizing. It might actually be the exact opposite, that the male might play a larger role in placental development and placental attachment than what we were originally thinking. And so it was really nice to hear Chris talk about the Sire side there at the end, because I'm going to show some slides toward the end of my talk that are going to point us in that direction. So the question is, how can we manage pregnancy loss today? You know, we really struggle with all the factors that go into pregnancy loss, and there's a whole range of them. I'm just going to highlight a few of them. But one of the big ones that we've been interested in is estrus around the time of AI, or estrus prior to embryo transfer, in these large time AI protocols, both in the beef and the dairy side. And a number of years ago, when I first met Boyd, when I was at University of Missouri, we teamed up and started using EstroTech patches and scoring these patches on a 0 to 4 system, where essentially a patch score of 0 is a lost patch, which happens very little now in the work that we do. And then these from a patch score of 1 to 4. As you get 0 to 25% of the patch rubbed off, it's a 1, 2 to 25, a 2, 50 to 75, a 3, and 75 to 100, a 4. And a lot of our projects, we characterize this as no or low estrus intensity, and these patch scores of 1 and 2, versus when we get into patch scores of 3 and 4, having high estrus intensity. I realize this isn't a perfect identification system, but it's what works well on the farm for the producers that we work with in order to get this data. Now, in some of the original projects that we did with this scoring system with Marcus Pieta, a veterinarian out of Brazil, where we looked at fixed time AI pregnancy rates in lactating Holstein and Gerlando cows. We did all fixed time AI, but in the case when the cow came in for the fixed time AI, we scored the patch again on the 1 to 4 system, whether she showed estrus or not. And in this situation, you can see the cows that showed estrus at the time or prior to the time of fixed time AI had higher pregnancy rates, both at day 32 and day 60, and they also had lower pregnancy loss. Essentially, in the big herds that we work with fixed time embryo transfer with IVP or in vitro produced embryos, we saw the exact same trends, which was not surprising. In fact, the cows that showed estrus had a little bit better pregnancy rates compared to the fixed time AI cows, bypassing that heat stress based event that we see in South America. So this really gave us an idea that, yeah, you know, this is a tool that can be utilized to identify and sort of sort out animals from a pregnancy loss point of view to minimize our pregnancy loss. It doesn't fix the situation, but in order to minimize it. So one of the things that we started to look at is basically in data sets all across the US and across Brazil in regards to how true this was over really large herds. So this is showing the exact same patch scoring system over herds in Brazil, where you can see a nice stepwise increase in regards to pregnancy rates at day 30 from somewhere around 35% up to about 65%. And in the US, you can see in the patch scores of 1, 2, and 3, really no difference. But as we got into those patch scores of 4, where you had a really high estrus intensity, you know, you saw this nice increase in pregnancy. And there's a lot of data to suggest that this is true. A lot of data out of Canada from a close colleague, Ronaldo Sehi, that also shows very similar trends. We've also done a lot looking at the amount of pregnancy loss that comes off these different patch scores, and a lot of this data is summarized into a single slide here, where essentially you can see these patch scores of 1 and 2 have a lot more pregnancy loss from a P1 to a P2 compared to these patch scores of 3s and 4. And so this is basically just showing that. Now, at the time, we were scoring these patches based on visual observation and trying to get these scored on different farms, which was working well because we were training the graduate students and farm personnel to do it. But we quickly realized that it wasn't the easiest thing to do to tell the difference between, let's say, once 50% of the patch had been active, which is what puts us into that threshold of 3 or 4. So at that time, I asked Estrotech if they would be willing to print me some patches that were more eye friendly to be able to determine when this 50% of the patch was rubbed off, which is essentially what this dot is, or this bullseye today. And you can see as the rubs increase on these patches, you can start to see that black dot rubbed off, where we get to these last 3 patches here, which have patch scores of 3 or greater. So essentially, we took that exact same idea with those patches and wanted to look at something that we've spent a lot of time focusing on. So pregnancy-associated glycoproteins, or PAGs, are the marker of blood and milk-based pregnancy detection that are being used all over the world now. I'm sure most of you are familiar with this. But we had a lot of data both in dairy, beef, embryo transfer, AI, etc., showing that as these PAG levels increased early in gestation, you got an increase in the success of pregnancy in those cows. And the same thing is true as it increased, you got a significant decrease in the chance to lose a pregnancy. So essentially, these 2 slides summarize a point that if PAG is high early in gestation, it's a good marker that the animals or the cow is going to go on to maintain a pregnancy, or the heifer is going to go on to maintain a pregnancy. So one of the things that we started to look at is, what do PAG concentrations look like in regards to estrus activity? And one of the really surprising things is what we've seen and continue to see as you increase estrus intensity, or the measure of patch score, which is a marker of estrus, we get an increase in the concentration of PAG in these pregnancies, which is not surprising because these 3s and 4s have decreased pregnancy loss, which is exactly what we'd expect if they had higher PAG levels. So some interesting physiology there to point us in a direction that I think that obviously estrus intensity is something that's critical and we need to keep an eye on. This is also a small data set of beef animals, just to throw this in here to show that as TAI Patch increases, this is a set of animals here in the US, as TAI Patch increases again, you see this increase in pregnancy rate at day 30, and you see this increase in PAG in these animals that are really having high estrus intensity or fully rubbing off their patch. Now, one of the things that we've been interested in is what's the effect of the sire on all this, and how does the sire play into this, and is the sire having any effect in regards to pregnancy loss? This is a set of about 100,000 inseminations of Holstein sires, all with qualifying SCRs or sire conception rate in the database. They each have at least 100 inseminations, where we have pregnancy rate in the maroon bar, so that's the darker bar, and then I have it sequentially graphed out by pregnancy loss. So I have a P1 and a P2 pregnancy diagnosis here. And what I just want to show you is that there's not a direct correlation between a P1 and a P2 in regards to pregnancy success. Now, the point that's also critical is to remember that you can't lose a pregnancy without having one. So you've got to take that into account as we sort of think about this here in regards to what it means. But look at the variance in pregnancy loss from a P1 to P2. We have a sire that has a 6%, and we have a sire that's all the way up to 37%. So a lot of variation in regards to what's going on here. And just as Chris talked about how they're trying to understand the genetic contributions to some of the things that they're interested in, now with these phenotypes, and I have a lot of other phenotypic data that I'm not showing you here today in regards to this, we're trying to understand the genetic contributions to these sire phenotypes in regards to pregnancy loss. The other thing that we've done is more closely characterize these phenotypes really from a day 24 to 31 range, and then from a 31 to 60 range, where we call this early embryonic mortality and we call this late embryonic mortality. The one thing I want to show you on this really busy slide here is that just because a bull has high early embryonic mortality does not necessarily mean that he's going to have high late embryonic mortality. These classification systems change. And so the point that Chris made in regards to really large data sets, it's critical on the sire side of things, because now we are seeing these sires that, depending on the point of gestation that you look at, also have differences in regards to fertility classifications. The thing that was interesting as we looked at this and looked across all these different data sets, one of the things that stuck out is that sires in general, when you use them in an estrus-based event in this lighter color bar here, they all have higher pregnancy rates compared to when we used them in a non-estrus-based event, or when the patch wasn't activated, except this one sire, Sire 3 in this case. As we look at late embryonic mortality and early embryonic mortality, we essentially saw the exact same thing. In bulls that have high late embryonic mortality, you essentially saw more of that effect in the no estrus situation compared to these bulls that had low late embryonic mortality, where we didn't see as big an effect in the no estrus situation, which is pointing to the fact that they're doing better in those cows that essentially are having low estrus intensity or no estrus intensity in the TAI protocols that we are using here. So not only is estrus critical, but it's also having a big effect on the sire side of things as well. The other thing that I wanted to point out is when we look at estrus and embryo production, a lot of times I hear people say that it's not critical for the donors to show estrus, or it's not having that big of an effect. But when we essentially look at this, when we look at donors that come into estrus and have a strong estrus intensity, we see an increased number of viable embryos, increased percentage of viable embryos, which essentially comes from an increased number of follicles coming from those donors. So just wanted to give a little idea of some of the things that we're working on, and in summary, we're chasing sort of this estrus-based factor in regards to pregnancy loss, and in our hands, one of the things is that if you increase estrus intensity or estrus expression prior to a TAI protocol, we're going to get an increase in pregnancy establishment, but also an increase in pregnancy maintenance.